Hi, everyone, and welcome. I'm Ashley Munninger with the National Organization of State Offices of Rural Health. Thank you so much for joining us on National Rural Health Day. Today is all about celebrating the power of rural, lifting up the people, partnerships, and innovative work happening across rural America. And today's conversation fits right into that mission. Cybersecurity is absolutely essential for rural health, and we're excited to explore what that really looks like with some of the leaders at the forefront of this work. Just a couple of quick housekeeping notes before we begin. Today's session will be recorded, and we'll share that link afterward on the National Rural Health Day website, which is powerofrural.org. Also, you can submit questions anytime. You'll find a Q&A box at the bottom of your screen, and we'll try to save some time at the end to answer as many of those questions as we can. And now I'm pleased to welcome today's panel of experts from the Center for Long-Term Cybersecurity, Dakota State University, Madison Regional Health System, and Google Cloud. They're here to share real-world stories and insights around strengthening cybersecurity in rural communities. Leading today's discussion as our moderator, Ann Cleveland. Ann is a true leader in cybersecurity research and education. She leads the Center for Long-Term Cybersecurity at UC Berkeley and co-founded the Consortium of Cybersecurity Clinics. The consortium brings together clinicians, students, trainers, and advocates to set up cybersecurity clinics at colleges and universities, offering free support to nonprofits, small towns, and other community organizations, which helps to expand access and lower barriers to cybersecurity. We're honored to have all four of you with us today. So Ann, the floor is yours.
Thank you, Ashley, and thank you to NOSOR. It's really our honor to be here talking about this important topic. And happy National Rural Health Day to everybody on the line. So as you heard from Ashley, cyber attacks are a big deal in healthcare. Cyber attacks on hospitals are growing threats to patient safety. A ransomware attack can disrupt critical hospital systems for weeks, impacting everything from cancer treatments to emergency care. Yet, even the largest healthcare systems are often underprepared to stop these kinds of attacks. And in a rural healthcare setting, the problem can be even more acute. Luckily, I'm joined here and delighted to be joined here today by some innovators that are offering solutions and really making a difference in cybersecurity for rural healthcare on the ground. Um, Everybody here is trying to help rural healthcare build more cyber resilience so that we are hopefully making an intervention, as they say, left of boom before that ransomware attack happens, and then helping people recover in the event that it does. So Ashley told you a little bit about cybersecurity clinics. These are programs around the country and increasingly around the world that train students to give hands-on cybersecurity assistance in their communities, including rural communities. And there is now a national consortium of cybersecurity clinics where students are working with nonprofits, with small businesses, with small municipalities, small healthcare organizations, K through 12 schools, and many of the other organizations that uphold our communities and our civic life. There's a national consortium of cybersecurity clinics, 41 clinics in 27 states, plus the District of Columbia, and more coming. So we wanted to show you this so that folks on the webinar could see if there is a clinic in your community. And we're going to hear about one of the clinics at South Dakota State University in today's conversation. But the cybersecurity clinics are just one of the innovations that are making a difference in cybersecurity for rural healthcare. As I said, we'll tell some real world stories of a partnership between the South Dakota State cybersecurity clinic and the regional hospital. We'll talk about the outlook for the Rural Health Transformation Program in cybersecurity, and other ways that academia and industry are partnering to strengthen cyber preparedness in rural health, and more. Um, so I'm going to introduce our panelists in just a second, but I think before we go there, Nosor had teed up some poll questions, so just so we can all get a sense of who is in the audience. So if you are online, please respond to the poll that should be showing on your screen right now. The first question is, if a cyber threat popped up today, how ready would your organization be? And then the second question is, what is your biggest cybersecurity challenge right now? And as soon as we get a critical mass of votes in, we will share the results. Okay. While folks are voting, I'm going to go ahead and introduce our panelists. Um, oh, wait, here we go. I think we've got the results coming in now. Um, Ashley M., should I read these results or do you want to do that?
Are you able to see them? Did they
I can
pop
see them.
up?
Yeah. Yep.
Yep, go for it.
Okay. So 18% of you said you would be very prepared if a cyber threat popped up today. 43% mostly prepared. 30% somewhat prepared. And then 9% not prepared. That is great to see that so many of you have taken some steps in cybersecurity. Um, and then, Ashley, I actually can't see the answers to the second question.
Okay, sure. So it says, what's your biggest cybersecurity challenge right now? 37% said lack of funding or resources, 46% limited staff expertise, 31% outdated systems or infrastructure, and 39% said lack of awareness or training among their staff, and 9% was regulatory compliance burdens. A little bit of everything.
Yes, thanks so much for sharing a little bit more about yourselves and what you're struggling with. And hopefully, we'll be able to address some of these things today. I'm really pleased now to announce our distinguished panelists. We have Ashley Podrasky, who is the Vice President of Research and Economic Development at Dakota State University. We have Josh Entringer, the Director of Information Technology at the Madison Regional Health System, and Sarah Morales, the Senior Program Manager in the Office of the CISO, Google Cloud. So thank you all so much for joining us today. And I'm going to dive right in with questions. And I hope you'll tell the audience a little bit more about yourselves and your work after the conversation. So, Josh, I'm going to start with you. Can you set the stage a little bit for our audience today? How big is Madison, and what's the geographic area that the hospital supports? What's unique about cybersecurity in this context?
Sure. As far as the hospital itself, we have roughly about 270 employees. The community of Madison is close to about 7,000. And then, of course, we support several of the smaller communities and counties throughout the area. And we're sitting between two bigger areas of like Brookings and Sioux Falls. So we have that challenge. It's like we do provide that critical access, which is definitely a good thing if you're here. We have the healthcare right here in the community. Saves you from having to travel that extra distance to the larger areas for care and everything. It's also a challenge too, being close to the larger metropolitan areas and everything like that. There's definitely more offerings there. So I'd say a challenge for us too is being able to offer that same care here closer to home. It's always a challenge here as well. As far as I'm trying to stay on track here, but as far as taking care of the community, the cybersecurity threat is still real here, even though we are smaller. We're still just another target. being looked after, and we have to take in consideration of our not only our staff members but community members too, and taking care of their not only their healthcare needs but their cybersecurity needs and keeping all their information safe. And I don't know, that's where I'll start.
No, that's a perfect way to set the stage. And I know what you just described will resonate with many communities from across the country that are joining us. I think at one point when we were discussing the panel, Josh, you said we're just in a situation where multiple people have to wear multiple hats.
Right.
Um, so Ashley, I'll turn to you next. Um, how did DSU get involved in cybersecurity for healthcare? And how did the partnership with Madison Regional Health System come about? Like, what were you seeing from where you sit that about what's at risk in cybersecurity?
Thank you. At Dakota State University, we have been focused on cybersecurity education for decades. We're one of 11 universities that have the accreditation from the National Security Agency and Department of Homeland Security in cyber operations, which is offensive, cyber defense, and then cyber research. And so I say all of that to mention that we are focused on cybersecurity, and our students get hands-on practical experience in cybersecurity. So for a number of years, we've been helping our local governments and small businesses with cybersecurity, but we didn't have anything to help our healthcare partners throughout the state. And when I learned about the Google Cybersecurity Clinic, I thought, well, this is the perfect thing to help us help more of our community. And so being awarded the grant to support the creation of our cybersecurity clinic, we were then able to get directly involved in helping the community that we hadn't been able to help, and healthcare was one of them. And so knowing our Madison Regional Healthcare System and some of the challenges that they might have in terms of financial resources to be able to conduct the security assessments that they need, we reached out to let them know what we can do for them now that we had the funding from Google. And so we performed internal, external pen tests. We also do risk assessments with the Cybersecurity and Infrastructure Security Agency. And then we focus on a lot of open source intelligence for dark web analysis. So we want to see what bad actors have acquired on the domain or the key personnel, so that way we can alert them if there's an issue that happens.
That's amazing. And Ashley, I'd be curious just to follow up on that. What are the kinds of patient outcomes that really matter when you're talking about cybersecurity? You had talked a little bit about the ability for people to age in place, for example. How does technology and cybersecurity play into that for patients?
Yeah, absolutely. So as Josh told about, we have a community north of us and one south of us. The one north of us is, we say, a larger city, but it's 20,000 people. And the one south of us is our largest city in South Dakota, and it's 250,000 people. So you can see communities inside of large cities that exceed those populations. And so our population really is spread across the state. And when you look at aging in place, and with our community that we have, you have people who go home with sensors. They're checking one ailment or another. So let's say it's blood pressure or oxygen or something. And those sensors are smart. They're connected to the internet. And so you have patients with the ability to age in place and not be in a facility, be at home. And as they go from home with their device to the clinic to visit their physician on a routine checkup, that device now comes into the clinic network. And let's say that they're hospitalized. Well, then now that goes to the hospital. So as you look at these different IoT devices or Internet of Medical Things devices, you can see that area that we have to protect and secure expands with aging in place. And so working to help people and patients understand that your home network has to be secure, so that way when you bring your device into this environment, it's secure, or if you go into this environment. And so trying to bring in those cyber hygiene skills, not just at the hospital level, but at the home level as well, because then we can truly help everyone stay more cyber ready.
Thank you. Yeah, I mean, what a lot of complexity that adds, for sure. So Sarah, now turning to you, Of course, Google has made now over a $25 million investment in these cybersecurity clinics all over the United States, including the one that we're talking about today at Dakota State. But how else did Google get involved in cybersecurity for rural health? And what do you see as the role that industry and that technology companies like Google can and should be playing?
Sure, yeah. Thanks, Anne, and happy National Rural Health Day to everybody. I'm Sarah Morales. As mentioned, I'm a program manager in our Office of the CISO at Google Cloud, but I've actually worked in kind of community engagement around cybersecurity for the last decade for Google and in different initiatives. And I was lucky to meet Anne and many of the students and staff at Dakota State through our investments through the cyber clinics, which were focused on both workforce development and education. But about 2 years ago, or a year and a half or so, I was lucky to take on a leadership role in our rural health commitment. So this came in around spring of 2024, where the federal government was looking a lot at cyber risk, both in healthcare, but particularly in rural healthcare. And they came to a number of private sector organizations that have done this kind of community engagement work around security and asked them, could we all collaborate together to try to address some of the rising risk that was happening in rural health facilities? So Google came together with some others to think about, okay, what kind of role could we play? So part of it is offering our products and expertise to these communities. So going out and doing educational initiatives, providing discounted and free products, that are focused on increasing cyber hygiene and resilience, as well as looking at different partnerships we could have with organizations that we know are working in the space, such as National Rural Health Association and a couple of others. And so part of why we got involved is, Google security has been part of our success, right? And prioritized since the beginning of the company. We can only serve our users if our users are safe. And I really liked what Ashley was talking about. It's not just about being safe in your one location, like in the hospital or on your own desktop or on your own computer, right? Security is where you are out in the community as well, whether you're visiting a different website or visiting a different facility. So a lot of what we try to think about is how can we keep our users, our customers, and our community safe at scale. And so part of that is serving big customers, right? Google has a number of big healthcare customers as well as smaller customers. And so a lot of what we've been trying to do is think about what is the expertise we have here within Google and how we can share that with different facilities. And then how can we also kind of customize our products and our offerings to serve those users as well? Because we know sometimes the challenges are similar in a bigger, small facility, but oftentimes they're different, right? And we could see from the poll, things like resources and just funding are a challenge. Sometimes it's the infrastructure that you need to manage. But there's also lots of innovation there too. And that's one thing as I've led this project over the last couple of years is how much innovation really sits within rural communities. And that's been really interesting for me to bring back even into Google of, how are they innovate? How are folks innovating? I'm sure Josh is innovating, will tell us more on that within these rural settings, and how can we then use our expertise and their innovation to collaborate together.
Yes, I think innovation is definitely a theme of this conversation and a theme of the day. So thank you for that. So speaking of innovation in action and success stories, I know everybody always loves to hear stories about our students out in the communities. So Josh, I'm going to turn to you again. You've had the opportunity to work with the students in the cybersecurity clinic at Dakota State. Can you just share with everybody what your experience was? What kind of work did the students do with you? What made it exciting?
Yeah, absolutely. What was really great about the partnership that we were able to do with the students here is, we're not only giving them the opportunity to come into a real, real workplace and do a real test. It just gets them into gives them an opportunity to get out of the, let's get out of the lab a little bit and let's go try our skills in real life there. And from my standpoint, looking how professionally professional they were coming out. We've partnered with several different organizations to do our internal and external security over the years, and it's very, very reassuring that just as students, and they're not even out in the real world yet, and they're being able to conduct themselves just like any of these other organizations we've worked with. You can really tell that the education's there and the real world experiences being taught just in the classroom itself.
That's great, and that's actually something we hear from clinics and the clients of clinics all over the country. Of course, the students need to come in with those technical skills so that they can really be helpful to you in that healthcare setting, but also the less tangible skills like translating technical information to a non-technical audience,
Right.
the teamwork and the leadership. So that's really neat that you saw that in your engagement with the clinic at DSU. Ashley, I'm going to pick up on that with you. What kind of feedback do you hear from your students about working in the community this way? And what do you think they're taking from an experience like working with Josh and the hospital into their professional careers?
Yeah, that's a great question. I'll start by saying that our students are working with full-time research engineers. And so we understand that there's a liability when you have a student in a production environment, and that sometimes things can go wrong. And we want to minimize when things can go wrong and ensure that that end site is able to stay up and running as we're looking at their security limitations. And so we have our full-time engineers that are working in this space who are pen testers. And then our students get to support that work. So our students aren't ever working independently without the engineer. And that's important because as you look at these facilities, if you take one down because you got a little aggressive or your tool wasn't tuned exactly how it needed to be, you could impact the surgery that could happen for quite a while in that facility and impact care. So it's important for our students to learn that lesson, that what they do with their hands on the keyboard has a direct correlation to an end user's being able to conduct the business that they're doing. And so that's why having that full-time engineer is critically important for all of our work. But our students get to see and emulate what our engineers are doing. And I think that that's why they're so in tune to professional communication, ensuring that they're representing themselves well, because they see that with that mentoring that they get from their engineers. So our students are thrilled that they get to try different things. And there are times that they come up and say, hey, I read about this new tool. I'd like to try it. Could we give it a shot over here? And so we have some sandboxes that we let them try those things in first, because we're not about to deploy an unknown tool that someone just found over the weekend in a production environment. But and that's where, as Sarah was talking about with some of the work that they do and competitions that they do, our students get to go out and try all the things that they want to try in the competitions, and then they can fine tune what they've done over there and bring it back into the production environment. So our students leave with, there's a 99.9% placement rate with our cyber students at the university. And it's the hands-on experience that they're getting in the clinic that allows them to be an in-demand employee for our economy.
Amazing. And so great that they're getting that hands-on experience and really making a difference. Josh, can you speak to, what was improved for cybersecurity for you and your team as a result of working with the student team?
So, going back once again, it's good to have like the an external organization come in and, test our systems. We like to think that we're doing a good job with our internal controls, our internal vulnerability management. What's good about partnering is they'll find something that maybe we didn't see or we got overlooked. So just even working with the DSU students, again, going back to that, they did find one. They got on a machine. The good thing about it is we did catch them getting on the machine, and our controls then locked them down. They locked that machine. It's isolated. They couldn't do anything. But me being kind of the mad scientist I am, I kind of I opened it back up the next morning to, just test the rest of my team a little more, because some of them, didn't know that happened. They aren't on the alerts or whatever like that. So it, it's definitely a good test to see how my staff would react to it. Even, we did inconvenience a few of the hospital employees a little bit. They're very little annoyed, but it's like, we weren't doing this to an OR crew or anything, or an emergency crew or anything like that. It was some office staff, but it was a good test to see how internal staff reacts to that kind of disruption, as well as the IT staff. So
That's great. And we've all been on the other side of being the
right,
the slightly annoyed employee when
right.
somebody's doing some cybersecurity testing or training. Um, so I want to next ask the whole panel, there may be some people in the audience who are either at a rural healthcare facility or maybe at the local college or community college, and they're thinking, it'd be great to do a clinic partnership like this in my town or my community, but we don't necessarily have the research engineers and the years of experience that Dakota State has. Is there anything we can do where students can make a meaningful difference without necessarily being hands on keyboard or going into that pen testing? So I want to ask the panel, if another community wanted to replicate this academic, regional health system partnership, what would you recommend as a way to get started? What kind of practical tools can people use?
Well, a few weeks ago, I had the opportunity, I was in Boston to participate in a panel similar to this, and I reached out and connected me with different Google clinics, cybersecurity clinics in that region. I was able to go and talk with them and learn what they're doing and how they're helping their community. I see a lot of people start with risk assessments, and that's how we started at DSU. And risk assessments are, you're not, yes, there's hands on keyboard, but you're not intrusive. You're not trying to break into their environment. You're walking them through a process. What are the assets that you have? What's the mitigation that you have? What's your residual risk? And how do you want to mitigate that? And so that's one good way to start, is looking at that, because you can go from a different approach. Carnegie Mellon has a really great tool for this, and CISA uses that tool in their risk assessments. So that's how we started a long time ago, is helping do risk assessments. I think we were probably in some classes at the same time in graduate school where we were doing risk assessments. So 20 years ago.
Yeah, 20 years ago.
Doing risk assessments for businesses. And so we've morphed into being able to do offensive security against them. And so we have our policies and procedures that allow us to do that in our contracts. I've already shared all of the contracts that our attorneys have created and vetted for us that we have with every institution that we're working with. Every Monday, we start 9 new entities on pen tests, internal, external. And so we're a good machine that way, a well-oiled machine that way. So I would start with risk assessments, because you got lots of people in your community that needs help. Look at nonprofits. That's where we started. And then reach out. You have entities like us who've been doing it for a while, and we have we've paid for the attorneys to make the legal forms to ensure that we are able to conduct those offensive attacks against the networks we don't own. And happy to share.
That's really helpful. Thank you. Anybody else want to jump in on that, or should we keep going? I'll keep us going. But I love that idea, starting with the risk assessments. That's what the consortium of cybersecurity clinics also sees a lot of clinics doing in their communities. And, students will tell us it's some of the most creative work that they've ever done in cybersecurity, because first of all, it's in a real world environment. And second of all, they're often working with an organization who has very limited or zero budget for cybersecurity. So you really have to work with them on solutions that will stick, that they can maintain and implement, but that maybe don't come with that budget attached. Great. Well, let's talk about some of the other hot topics in cyber for rural health that you are all seeing. Um, Josh, I'm going to turn to you again. We talked about this a little bit before the panel. So obviously, AI risk management is becoming a bigger part of cybersecurity. So from where you sit, you have to secure your systems against AI-enabled attacks and manage the risks of any AI systems that you're implementing at the hospital, manage those risks themselves. So how are you thinking about both the opportunities and the risks in tandem for Madison?
As far as looking at securing and implementing AI, uh, and kind of I think about everything I've seen too is I'm always try to take the just a slow roll approach when implementing stuff like this. Like we're not just going to go and obviously just turn AI loose on every system in the organization and see what happens. That'd be impractical. It'd probably cause us more headaches than we would save by doing that. So I'd say going with the slow approach to AI, get an idea of what it's going to do for you in the organization, what it's listening to, um, and then uh, it keeps me up at night, honestly. But there's so much to talk about with it. Uh, you just got to think, especially with our situation, when we're dealing with all this patient data and all this stuff. The last thing you want to do is put AI into our electronic health record. What's it going to do with that data? How is it going to group it? Where is it going to store it, broadcast it, or anything like that? So when I'm approached with adding AI, it's like, okay, first thing we're going to do, like, what's it listening to? What are you going to do with it? What do you want to connect it to, and all that stuff. So, but yeah, I just always caution people, and this is with any system, just slow roll, test it with a few people, a test environment, sandboxed environment, if you will. And when you start feeling comfortable with that and you see the positive results you need, then move forward.
Thanks so much for that. And I wish we could do another poll and ask the audience how many people does AI keep them up at night? And I bet you would
Yeah.
not be alone in that sentiment. So thanks so much for your candor. Um, Sarah, how are you seeing AI roll out across the board in Google's rural health partnerships? Like, what are some of the solutions you see that are working, whether that's training or shared services or other resources?
Yeah. And just before I answer that, I want to build on what Josh was saying. Like, since we have security is what we're focused on. Yeah. Like making sure you're doing your vendor assessment up front is really important, right? Understanding who is the AI vendor, what are their security practices? Yeah. What data are they going to touch? Are they, are they following HIPAA compliance or not? As well as what need does your facility have, right? Is it going to bring more toil or is it going to reduce toil, right? And I think that, the big benefits of AI is it's not going to, you don't want to replace people. It's to help the people who maybe, so they can focus on more important outcomes. So a lot of what we think about at Google is that. So what are things that are taking up doctors' times, nurses' time, frontline staff's time, and how can AI help with that? So whether that's a partnership on taking notes for doctors. I mean, many of us probably already seeing this when we go to our care appointments, right? The AI tools being used to take the notes for the doctors, for the nurses, for kind of discharge changes. There's a lot of places where AI can kind of take away that time spent on the keyboard to allow them to spend more time with the patients. I think also we're going to see more, and I've talked with some of our facilities about thinking about the community-based outcomes. So how can they take the data that they have and look at, what are the population that they're serving, what tends to be some of the health challenges those populations have, and how can they better serve those groups. So say if they're looking at rates of diabetes, maybe there needs to be more education through community health days on, healthier eating or different medicines that apply to that. And AI can help you then looking at your data, come up with some of those understandings within your community and some of the solutions. It's also will be used more for doing security work, right? So how is AI being used as, maybe you don't have, a staff that can monitor all the logs. Well, how can you use an AI tool to do that for you? So I think all of it comes with the asterisks of you need to be careful of what tools you're using, how you're, kind of Josh saying, slow rolling it out, and also doing that change management with your staff to thinking, making sure the staff is aware of how all these tools are being used. But there's so many great applications that are, that some that have started and more that are coming that are, I think, going to be really helpful to rural communities, especially on the staffing side, right? I'm sure there's more radiology scans happening than the radiologist can review. So how can AI help supplement that person's job so that they can get to more of that and then work more in delivering the news or whatever else they need to be doing day in and day out?
That's great. Thank you for that. Ashley, I'm going to let you respond to that, please, because I think we'd love to hear your perspective, especially, well, yeah, go ahead and respond to that. And then I've got another question for you.
Yeah, I'll answer this both as a patient or a parent, and then also as a practitioner who could be involved in setting up a system. So I'll start on the patient or parent side. I live in a community where I have really great friends who are physicians, and sometimes I lean on them a little more than I should. I have one kid who is just a daredevil, and he seems to get hurt all the time. And so I've been on FaceTime with some of my friends who are physicians with a gash in the back of his head. What do I do? Do I need to take him in? That kind of thing. But as I see things with my own kids, if they have a rash or something, and I think, well, maybe I can not bother my friends right now and take a photo and see what AI tells me. And for low level things, I find that helpful. But I want to make sure that what I'm putting in there is safe and secure. And so looking at the foundation of cyber, confidentiality, integrity, and availability. When you set up an AI system as a practitioner in a facility, you need to make sure that your data governance and your data standards are lockstep and very tight and controlled. Because if not, that system is going to start looking at those records and it's going to incorporate them in its output. And so you might not know that you had some misconfigured parent-child relationships with some systems, or had view to another computer that had some local files that could be incorporated in there. But we do see that from time to time. When we go into businesses with our clinic, well, typically, if they have an AI system, we'll type in compensation, because that usually brings back comp plans that you can see. And if we have access to it, then that means it's misconfigured. And so we help them align that correctly to ensure that their AI system is only learning and bringing in data that it should bring in. And so on the healthcare side, we just absolutely don't want someone's personal identifiable or their records to be visible to someone else. And so making sure that you have that separation. So as a parent or a person, I'm more likely to ask a computer something embarrassing, which is helpful. But on this side, I want to make sure that that my data is not used to train or inform someone else inadvertently.
That is such a good example. Thank you for sharing that. And maybe just building on that, I know, another topic that is top of mind for this audience is the Rural Health Transformation Plan. And I know that DSU will be really involved in what you're doing in your state. So I wonder if you could tell us a little bit more about that and how that fits into the AI and cyber expertise that you bring.
Yeah, that's a great question. DSU has been part of a health information exchange for over a decade. South Dakota was one of the first states to have near total adoption of electronic health records. And I can say that, right now we have under 1 million people in our state. So again, it's a little bit easier here than it is in other places. We're working on getting all the outliers, small clinics, chiropractic clinics, things like that, brought into the EHR. But we've done that here through DSU. But now we're working to secure and optimize that as well and integrate AI when appropriate. So starting to look at those kind of things. And so with our Department of Health, we have several employees who are DSU employees that they contract with that are in our MAD labs. And they're working on these areas and we're proud to support them. But we're a small state population-wise, geographically, we're large. And so we know that we have to be able to share our expertise with our community, and we're proud to do so. And in this case, we get to integrate cyber into so many different domains, with healthcare being one of them.
Amazing. Thank you for that, all of you. We're actually starting to get some questions in the Q&A, some good questions. So I am going to turn to those. And please, to the audience, if you have other questions, please put them in the Q&A or upvote other people's questions. But for our panelists, great question about how are these topics in cybersecurity and AI risk management impacting telehealth and remote patient monitoring, where provider practices or hospitals are collecting personal health information data from patients receiving virtual care at home? That's a great question, and would love to hear your perspective, maybe starting with Josh.
It's honestly something I haven't done much with yet, but definitely another challenge with anything remote. There's kind of like with what Ashley alluded to earlier, instead of putting a device out there on a strange network, we're just doing a live chat or anything like that, and you're still having to get that data and information across that channel, right? And how do you do that securely? How do you do it privately? There's a lot of things that you probably can't control when you can kind of control on your side at the facility, who's in the room, who's listening. When you get on the other side, it's a little more challenging, like who's with the patient, who's there to help the patient, and then get the correct experience, get the right diagnosis, and all that stuff there. So, like I said, I don't have a lot of experience. We haven't done a lot of it yet. It's a big question on everyone's mind. How can we do more telehealth, and how can we get to these remote areas? The biggest thing I've seen is we'd really like to see a little more of it with emergencies. We have like an ambulance out 20 miles out of town. How can we get a diagnosis there real quick, get a provider or physician online, and just be able to see what's going on there. We can do that in our own ER very easily, but getting the right setup out, like I said, when you're remote and you're in an emergency situation, can be very, very challenging.
Great. Yeah. Sarah and Ashley, anything you want to add to that?
I mean, I think the only thing which we kind of talked to earlier is that vendor assessment up front is really important,
Right.
and looking also at where and how the data is stored, the track record of the vendor that you're using. Also, just what is your organizational policy, and the policies within the healthcare facility, the staff, right? Worst thing you don't want is also people using their own devices and then setting up things. So a lot of it, I think, is like the vendor choice, the data storage, the policy within the group, and also staff training on who is accessing this tool as appointment scheduling is happening, and the reminder sending out, and probably some, and I don't know, Josh, is like often healthcare facilities are great places for cyber education, right? You have a lot of people who are coming in, so I'm sure there's initiatives that happen. I know at many rural health facilities that are also on, not just on health training, but on cyber training as well, especially with older populations, right? How to help them, spot the scam versus the real appointment, right? Like how is the facility helping with that? Because I know even with my own parents and my in-laws, like they get a lot of elder spam around medical appointments or health insurance. And so that I think is a big area to focus probably with the community as well.
Yeah, I like that conversation around scams because when it's hard for people in the know to distinguish between legitimate and phishing attempts. And so bringing that into a population who's elderly or just not as informed, the outcomes could be pretty significant. And I think that's an important area of basic cyber hygiene. You know, we wash our hands, we stay safe with masks in the clinic, ensuring that the system that you're using to access to talk with your physician remotely is protected and has the right mitigation on it is key too.
Fantastic. Well, I'm going to keep going through our questions because we have some more great ones. The next one is probably directed mostly for you, Ashley, and it's a question about the workforce. And the question is, are the Dakota State students at the completion of their studies staying in rural locations? And maybe just to upframe that from a yes or no answer, what are you seeing? What's working to make sure that rural locations are getting the workforce that they need in cybersecurity?
Yeah, half of our students stay in the state upon graduation and half leave. But if you look at it, half of our students at our university are from out of state and half are in state. But they're not the same population, which is really great. You're going to see people who are growing up in very urban environments come to South Dakota for school and they think, well, hey, we got Great Lakes, we have zero traffic, we have cold. Yes, we have that. But I mean, you have a lot of space and great people. And so you see people staying. You have people who have grown up here who I moved to Philadelphia after I graduated with my doctoral degree. I wanted to live someplace completely different. And now I'm back. And so you do get a mix of both of those, but we do have state programs with scholarships that encourage resident students to stay after graduation. And that's one approach that we're using here at DSU.
That's great. Yeah. And I mean, those kinds of experiences where students are working in the cybersecurity clinic with real organizations in the community and can imagine themselves in those kinds of roles are something that we hear is so important for recruitment as well.
Yeah, they feel like they're making a difference. They're not just one of 50 in their department. They can see the impact that they're having within their community, and that makes them feel good. And that's a good thing.
Great. Well, so the next question, I'm going to upframe a little bit because it's a really good question. It's a question about what are the partnerships with rural local governments across Google or Dakota State. And I'm going to expand that to say, in a rural healthcare context, of course, you're not working in isolation. So if there's a ransomware attack at your local water utility, that's going to affect, the hospital having clean water. Similarly, if there's some kind of outage at the power facility, that's going to have some ripple effects on the hospital. So, Josh and Ashley, maybe you could talk a little bit more about how are all of those collaborations across your community in cybersecurity, like intersecting in the healthcare context?
Want me to start? Sure. It is something that has been, we've had our tabletop discussions just locally with the city of Madison. We try to do, and throughout the state as well, they try to do one or two a year with different scenarios like that. Like, hey, what happens if you lose power, like you're alluding to, or like contaminated water? All these things have happened in this, small area, and they happen in the larger areas too. So it's the same thing. It's like, what are the resources? Who are we going to pull together in your kind of command center? Do we need the fire chief? Do we need the head of utilities, the mayor? You name it. We've had all these people in the room. So it's important, once again, to have that planning ahead of time? How well it was said earlier, how well are you prepared for a cyber attack? Not in your organization, but it's got to expand to the community as well. What happens? Who's out of power? Where do we start moving people to? Anything like that. So the key thing is the education, the preparation, and being able to work together just in your local community to start with. And if it's beyond that, same thing. You just have to upscale it a little bit and go to that next level.
I love that response. Just yesterday, I was in our state capital. It was just Pier. And I'm on the governor's resilience and in infrastructure task force. So it's called the GRIT task force. There are 18 of us, and I represent the cyber piece for the state on that task force. But power, water, wastewater, transportation, our energy sector, we're all looking at ways that, with cyber being that through line of where do we make investments in the state to help everyone, so that way when one incident occurs, it's not a cascading impact across our community. And so we look at that intersectionalism of perhaps a natural disaster or natural storm. It's South Dakota, so it gets really cold and snowy in January, and a power outage. And then how do we look at that? And perhaps any geopolitical issues that are occurring that makes it harder for us to do what we have to do as well. I say that because this is something I get to report this year in our Google Cybersecurity Clinic. We do reporting every January, and so I've been waiting to report some really great things. But as I said, we started by doing security assessments for our local governments. So cities, counties, special water districts, our airports, our legislative research council, what have you. We have 66 counties in South Dakota, and we've worked with all 66 over the last 7 years, many every 6 months. And so that's a great thing, between training, helping them understand what you should do and what you shouldn't do, the offensive assessments to help them understand where their vulnerabilities are. But the exciting thing is we were able to get some legislation put in from our local senator, and we got $7 million to help with mitigation. And so one of the things that we're seeing with our local governments over and over again is that we actually didn't have a secure email system across the state for local governments. And so getting that up and going for them. We got that up and going in September. It was a long road. It's a long 12 months prior. But looking at the training, and then we have mitigation dollars for them to work with managed security providers across the state. So creating that relationship with an MSP. So when you think about, as Josh was discussing, that it's not just the hospital, it's the entire community that supports that. And if something goes wrong here, it impacts here. We were actually able to successfully work through our legislature to get $7 million to help with remediation. So in bigger states, that might not sound like a lot, but here in South Dakota, that gets us to a place where everyone's floor was raised in their cybersecurity resiliency and readiness.
That's amazing. And it's true. A lot of the other cybersecurity clinics across the country work with local municipalities, small local utilities. And it's really about getting that safety net of cybersecurity for the whole ecosystem. So I think we have time for just one more question from the audience, and then I'm going to do a closing lightning round. So somebody asked, have you partnered with a volunteer nonprofit like Remote Area Medical, which sees uninsured patients and people experiencing homelessness across the U.S.? They were thinking that might be an important place to test some of the cybersecurity, hands-on assistance.
We don't have an organization similar to that we've worked with in South Dakota with our clinic. We work with a lot of nonprofits, but we haven't worked in that specific niche area.
Yeah, I would say similar from our side. I'm not aware of a partnership. Google has lots of partnerships though across the business, so something could be taking place. But I'm not sure exactly there. There are, I think, probably maybe similar partnerships on working with health nonprofits or folks that are focused on, like helping people get access to care, helping to think about, travel to care, and, tracking, your data across different platforms and places, things like that. But I don't know that exactly, but that's really interesting to think about going forward.
Great. Well, I know our hosts at NOSOR are going to put some more resources um, in the chat as we close for people who were wanting to learn more or find other resources for rural health and cybersecurity. Of course, including the cybersecurity clinics at the consortium of cybersecurity clinics. So check out that map and see if there is a clinic perhaps in your community where you could do a partnership with a college or community college or university in your area. But in closing, I'm going to do a lightning round with our panelists. As you look ahead in cybersecurity for rural health, what makes you most excited or optimistic? And Josh, I'll start with you.
Sure. Excuse me. And we've already kind of discussed it too. We're just seeing some of the more government funding come out to help just the healthcare in the several states across the board. So it's very exciting just to see that additional funding. And then we're all optimistic that hey, we can get some of that. We can use it as a I wouldn't expect it as a long-term resource, but at least something to maybe get off the ground, or get ahead of the curve a little bit, or in some cases for some organizations to try to catch up, get that new equipment, have some of those just some be able to get those additional resources for the internal and external evaluations and stuff like that. So that's very hopeful, seeing that coming out, and they're trying to, I mean, just by the end of this year, calendar year, hopefully, seeing the results of that.
Fantastic. That's a great example. Sarah, over to you, lightning round.
Yeah, I'd say +1 on the rural health transformation bill and what kind of projects people, I know there's, across the country, every state I think applied, and I'm sure there's lots of really interesting projects being proposed. So I'm both excited to see those pilots and programs, and also is how people are taking learnings from South Dakota and applying them to California and vice versa. One thing that, I've really learned over, the last year, as I mentioned, is how much innovation is happening in these rural spaces and connecting people together. Like that's what always, I don't know, brings me a lot of joy, is meeting two people who like to nerd out on data dashboards and AI and bringing them together. So I hope we can continue to do that in places and forums like this, because I think there's just a lot of ideas, and sometimes people just need that to like brainstorm back with each other, and then those ideas can spread out. So I'm excited to continue to see these kind of places where we can come together and share those ideas and then see them grow.
Yeah, I love the idea of nerding out, because there's so many things. There's so many things that are so great. Well, I'll quickly look from a patient perspective. I love that if I'm traveling for work, I can gain access and have contact with my physician who I know and trust, and that's fantastic. But as I think about the ways that you can introduce AI into medical imaging for breast cancer or things that affect women, to me, that's incredibly exciting, because you can start to see some of the hallmarks of cancer before you can actually see them in a mammogram, for example. And so as I look at the patient care experience, how we can get some earlier indicators of issues, so that way we can address them sooner and have a better outcome. To me, that's incredibly exciting.
Oh, well, thanks to all of you. Please join me in thanking our distinguished panelists for sharing their expertise. It's really been a pleasure. And Ashley, back over to you and NOSOR.
Thanks, Anne. And thank you so much to all of our panelists today for sharing your stories and your expertise and insights on this topic. We're really grateful for the work that you all do to help our rural communities stay connected and secure. And to everyone that has spent part of their day of National Rural Health Day with us, we appreciate you, and thank you for your time. As a reminder, we'll share a link to the recording and some of those additional resources at the powerofrural.org website. So on behalf of NOSOR, thank you again for celebrating the power of rural with us. Thanks.